So, a radical new approach is being developed by the UT Southwestern Medical Center in US to treat diabetes. The diabetes traditionally is being treated with insulin and oral hypoglycemic drugs. Now, the type 1 diabetes, which is caused by resistance to insulin, and the type 2 diabetes caused by an autoimmune response against beta cells are being approached through artificial input of insulin and oral hypoglycemic drugs. Now, the beta cells of the pancreas, which produce insulin, and alpha cells of the pancreas, which produce glucagon, are competing with each other and are mutually contradictory. So the new approach is to use monoclonal antibodies to suppress the alpha cells and the glucagon receptors in the body, leading to a reduction in glucose production. And additionally, when these antibodies are being used, there is a tendency for alpha cells to switch or swap with beta cells. In other words, the alpha cells which produce glucagon switch to beta cells. So it's said an enemy's enemy is a friend. So these monoclonal antibodies, which actually target the alpha cells and neutralize the glucagon receptors, is actually a friend to the diabetic patient, because his enemy being glucagon and the alpha cells. So an enemy's enemy becomes a friend. So in this approach, instead of artificially inputting insulin and oral hypoglycemic drugs, we use monoclonal antibodies to neutralize the alpha cells, which are glucagon producers, and reduce the glucose output. So this is actually handling the problem at the outset or at the root level. See, what happens in diabetics treatment as it exists now is the glucose, which was being neutralized by insulin, and when there is an insulin deficit or insulin ineffectiveness, external insulin or oral hypoglycemic drugs were being tried. But then it's a much better approach to destroy the glucose producing cells, that is the alpha cells of pancreas or the glucagon receptors of pancreas. So this approach handles the problem right at the root. So probably in future you'll find for diabetic patients a monoclonal antibody treatment, which actually reduces the alpha cells and causes alpha cells to switch to beta cells. Hope for the best. Thank you very much.